Hello, neighbors. On December 30th, the Sun Lakes Channel 97 team was able to film an interview between Dr. Judy Kirstein from Velocity Clinical Research and Dr. Singh of San Gorgonio Memorial Hospital. It was an extremely timely interview that we wanted to share with you so that you may better understand the current situation from the standpoint of two local medical experts. Dr. Kirstein is currently the medical director and principal investigator for the Moderna COVID vaccine trial at the Velocity Clinical Research Facility in Banning. She obtained her medical degree from UCLA in 1978 and began her private practice in 1981. In 1984, she founded Jordan Valley Family Health, one of the largest family medicine groups in Utah's Salt Lake County. In 1993, she began her research career with Advanced Clinical Research, now Velocity Clinical Research. Dr. Singh is the Chief Quality Officer and Medical Director of the Department of Emergency Medicine at Banning's San Gorgonio Memorial Hospital. He joined Sanji as a board-certified emergency medicine physician in 2017 and the leadership team in 2019. He graduated from UCLA School of Medicine and completed his MBA in Healthcare Administration at Loma Linda University and his residency in Emergency Medicine at Loma Linda University Health. We are grateful to these highly esteemed doctors for sharing this time with us.
Thank you, Dr. Singh, for taking the time to speak with us. We know you're really busy being the head doctor of San Gorgonio Emergency Room. And we know that you have seen the impact that COVID-19 has had on the hospital and the community, and are wondering what's going on at the hospital. Is the hospital having to divert patients at all?
It's a great question. The hospitals all in Riverside County are inundated, and that also includes San Bernardino County, San Diego County. So all the hospitals are getting inundated with COVID-positive patients, but also in addition to that, non-COVID emergencies as well. As a result, multiple hospitals are having to come up with creative plans to take care of these patients because of limited resources, limited staff, and limited supplies. In regards to your specific question, diverting patients, we're not able to divert patients away from the hospital. As the emergency department, we have to accept every patient that walks in through the door. Ambulances are coming in. We accept them as they're diverted from the base station. There are some Riverside County protocols that have been developed, such as APOD diversion. So if a ambulance is on the wall and unable to find an appropriate bed for more than 90 minutes, then there's an automatic criteria for diversion where multiple hospitals have been implementing so that the patients are diverted to the closest hospital that they're at.
What is the bed situation now at your hospital?
So very similar to multiple hospitals in the county. We're functioning above 50% of our ICU capacity at this point for our hospital. Also with the emergency department, our emergency department is 28 bed. 23 are kind of our back emergency department where we see some of the critical patients, and 5 beds are designated specifically kind of for urgent care patients. What we were learning during this COVID crisis or the surge of patients is majority of the patients that are coming into the emergency department are acutely sick. So we're having to use a lot of our resources towards providing care for those patients, and our emergency department capacity is beyond what we were previously used to.
How is the staff situation? Do you have many staff that are either quarantining or out with COVID?
Yeah, that's kind of been the storyline for several months, so to speak. The biggest risk factor that we are learning from studies from United States and other countries as well is the biggest risk factor for individuals that are even healthcare workers or not healthcare workers, the biggest risk factor has been pointed to is sick contact at home. And because of that, there are some colleagues of ours that have contracted, and by CDC guidelines, we're required to have them quarantined for the appropriate amount of time for their symptoms and at least a 10 to 14-day period.
Have any of your staff been able to get the COVID vaccine yet?
Yes, I'm so glad you asked that question just today. I actually received my vaccine today, this morning, so we received a shipment for Moderna vaccine, which we have administered to our clinical staff, our frontline staff, our medical staff, and the staff that's been vaccinated is not just primarily clinical per se. It's our housekeeping staff that's cleaning the patients' rooms, that's turning over radiology staff, that's taking x-rays of these patients. So pretty much anybody that's on the front lines of taking care of these sick patients and getting the exposure was put at the priority list for receiving the vaccine this morning.
Do you think you'll have enough vaccine for everybody who wants it?
Yes, for our prioritized frontline members, yes.
Do you have enough PPE?
Yes. Fortunately, we've been blessed to have enough PPE. I've been doing the COVID task force at the hospital since it first started back in March. And we've been very blessed to say that we have always felt safe and protected in regards to going into the patient's room and taking care of them, whether that's face shields, whether that's N95 masks or simple surgical masks that we wear throughout the day.
Which treatment protocols are you using for COVID?
So that's a great question because it's a very complicated question. COVID protocols, there's really no general guideline or specific FDA-approved medications that exist right now. A lot of medications that we hear about have received emergency use authorization through FDA. We are currently following the literature that's coming out from many different areas. The biggest things that we have learned over the last 7-8 months through the course of this disease has been learning about corticosteroids. So Decadron has been shown to decrease mortality in patients that need oxygen. So any patient that, for the most part, is admitted to the hospital with COVID pneumonia, so to speak, that needs oxygen, we're placing them on corticosteroids, Decadron, for a 10-day course for the most part. The literature for this and the medicine for this is changing by day. And by the hour. Before coming here, I was just talking to our 2 pulmonologists for the hospital and trying to develop a new protocol because there's new studies that came out just 5 days ago that are shying away from some of the previous recommendation guidelines when it came to putting patients on blood thinners for these COVID-admitted patients with pneumonia. And now the literature is showing that that's not the ideal case. So it's after months of studying this disease, having enough patients to learn from, and then we're slowly trying to peel back the layers of, okay, what really works, what improves outcomes, which decreases mortality in these patients, and we're all having to be flexible, be humble, and just learn from one another.
Is there anything else you would like to tell the people that are going to be watching this video?
Have faith. That's what I tell my emergency department team and the hospital team, that whether that's physicians showing up to work, the nurses, the EVS staff, stay home if you can. Wear a mask at all times when you're in public. I've seen it. It is a disease that definitely can impact your health very profoundly. Stay healthy, exercise daily if you can, take multivitamin tablets. That's what I'm telling my family members, to kind of protect themselves and protect their immune system. And just kind of the basic things that we kind of take for granted: hand washing, making sure that we're protecting our families and protecting ourselves. So just little things can go a long way in just protecting yourself and your family members.
Well, thank you very much. This was very, very helpful, and we're glad to know what's happening at our hospital.
Yeah, no, thank you for having me. And we have had a lot of outreach from the community. It's been heartwarming. A lot of our teammates have stayed here 14, 16-hour days, and only to come back again to do another 14, 16-hour day. Some of the physicians have been working very, really hard. And it's the support of the community. We have a lot of support from our leadership staff at the hospital to make sure that the utmost priority is to protect our patients and our frontline staff that's really in the midst of all of this. And it's been a tricky situation with the surge to have these difficult conversations with all our staff to how to keep them motivated. And that's been the challenge across all hospitals. Talking to my colleagues at other universities, it's just unprecedented times. But I think I've seen the best of my colleagues, best of mankind also come through, where everybody's kind of getting together and putting their heads together, coming together to see what we all need to do to kind of succeed and get through this.
Thank you so much.
Thank you.